Good evening, and thank you for tuning in tonight. This is New York City Councilman Chaim, and I'm filling in tonight for Zeb Brenner here on Talkline Communications Network. You're listening to Chaim on the radio at 620 on your AM dial. I'm joined tonight with my co-host, Dr. Faye Zakheim, who is once again socially distancing herself from me by co-hosting tonight over the phone. Welcome, Dr. Faye.
Hi, Chaim. Wow, this has been quite a day, Chaim. I hope you don't mind me saying this, I have not stopped hearing ambulances go back and forth at all day. What's going on?
Well, we're going to find out tonight. We have some very extremely special guests. It's going to be another very informative show. Our topic tonight is, as it has been for the last month, and that is coronavirus. It's really important to us that we break down the news and give you the cold, hard facts. Our guests tonight are all at the forefront of the battle against COVID-19. First, we are joined by two expert doctors who are infectious disease specialists. Rabbi Dr. Aaron Glatt and Dr. Richard Cofsky are both names you've probably been hearing a lot these past few weeks, and we are honored to have them with us tonight on the air. So Rabbi Dr. Glatt is also the chair of the Department of Medicine at Mount Sinai in NASA. He also serves as the chief of infectious diseases, and Dr. Cofsky is an infectious disease specialist in Brooklyn and is affiliated with multiple hospitals in the area, including Mount Sinai Beth Israel Hospital and Brookdale Hospital Medical Center. As you know, listening to the news and like Faye mentioned, hearing the ambulances going back and forth all night, fire department, Hatzalah members, EMS, and everyone, we have 385 deaths statewide, and we have over 30,000 cases of coronavirus statewide. So first we're going to hear from Rabbi Dr. Aaron Glatt, and welcome on the air.
Thank you very much for having me. It's such an important subject, and it's so critical that your audience know the medical facts, the halachic facts, and it can take them into consideration so we have a healthy Chag Kosher v'Sameach.
Thank you very much. And we're going to take some questions in the program. Our call-in number here is 718-303-9090. Jot that down, 718-303-9090. So, Rabbi Dr. Glatt, in your opinion, is the end of this national nightmare close, or do you think we have ways to go?
So, unfortunately, we have a long way to go. And we are partially at fault for that, and we are therefore also partially able to correct it. It is critically important that everybody realize we cannot go about business as usual. The Moetzes HaGedolah themselves, all the Gedolei Yisrael, from every branch of Shomer Torah Mitzvah life, have all paskined clearly that this is real Sakanas Nefashos. It's not even Suffolk Sakanas Nefashos. Look at any of the hospitals. Every hospital in the city is now overwhelmed. We have almost half the patients in each hospital that are just COVID patients. Nebuch, Rahman al-Islam, people are dying every day. Younger people, too. Not only older people, but younger people are dying. Hatzalah members are dying. People are dying because everybody isn't taking this seriously. People are still, I can chop a minion in my basement. Who will know? The police won't catch me. We can do whatever we want anytime. There are shuls that are open today in your neighborhood. There's shuls that are carrying on like it's business as usual. This is the Sutton talking. I spoke with the Moetzes HaGedolah. I spoke with many Gedolei Yisrael. This is the Yetzer Hara telling us, I never miss a minyan. I'm not going to miss a minyan now. This isn't the Romans persecuting us. This isn't governments that are cruel, tyrannical governments telling us don't daven. This is a Medina Shel Chesed with medical experts, with Gedolei HaRabbanim saying it is absolutely dangerous for us to go to shul right now, for us to make minyanim and shtibelach in our basements and to carry on like there's nothing going on. Nebuch, they're bringing people to the hospital by the droves. Hospitals are swamped. They're overwhelmed with people that don't listen to the Gedolim. And Rahman al-Islam, it's going to stay and get worse if we don't stop. People have to know that this is Yaharig V'Hayavar. This is, if you don't listen, people will die. Everybody has to understand this is the maximal pikuach nefashos situation that you could have. You cannot gather with other people. This is going to change the way we celebrate Pesach. You're not going to get together with the Bubbies and Zadies. It's dangerous for them. Older people, and older can be defined as anybody above 40 or 50 in this regard, are more at risk and can, Rahman al-Islam, get very severe disease. And the younger people who, Baruch Hashem, seem to be somewhat protected, but we're seeing plenty of 30 and 40-year-olds in the hospital and the ICUs as well. Baruch Hashem, not as much. But this is a machala that if we don't socially distance to the max, we should be machmirim on social distancing. We can't be around other people except if they're the people that we live with in our house. We must be very careful not to isolate people. We must talk to people on the telephone, through technology. I have to make sure people are taken care of. We can't physically be with the people that we otherwise would normally love to be with. At Smachot and at Rahman al-Islam and Avelus and Shiva, we can't carry on as usual or people will die.
So Dr. Glatt, so, Pesach is coming up. And people need to realize, they need to know that when someone gets infected, you don't get to know that you have COVID-19 until later on. So you can infect dozens of people, and those people could affect other people, and then it's a chain reaction. So can you explain to our listeners that how does one get infected by COVID, and why is it COVID-19? Why is it so important to distance yourself from others? And also, when someone gets infected, when does those symptoms come out, and what are those symptoms?
Okay, those are a lot of questions. I'll try to answer them. Please point out if I didn't catch every one of them. It's critically important for people to realize that you can be totally without symptoms and transmit COVID-19. Everybody has to understand that. The person sitting next to you, the person that's face-to-face with you in Shul on Purim, he could have given you COVID-19, even though he wasn't coughing, even though he didn't have a fever, even though he was perfectly healthy. That person may never even get symptoms, although many of them do get symptoms, but probably 10 to 20% never even develop symptoms. And if they do develop symptoms, they could be contagious even before they develop the symptoms. And that is why this is so easily spread. For every case that's known, there are many cases that are unknown, and they can spread like wildfire.
Doctor, I have a question for you. I actually have a question. You're mentioning Purim, but Purim was March 10th. Today is already March 25th, right?
Right.
So, or even March 26th.
So if somebody was exposed on Purim, and they were sick, and they got somebody else sick, that person may have gotten sick last week, or may have not, and they exposed somebody this week. So it's a continuous chain reaction. So yes, nobody today is probably, and we're not even sure of that, getting sick still from somebody from Purim, but it's the consequences. Who did they get sick on Purim? We have to understand that this disease is spreading like wildfire. There were no cases in Brooklyn 3 weeks ago. On Purim, I don't know if there are any cases even officially in Brooklyn. Maybe they had just started. I don't remember the exact dates. In Nassau County, we had 0 cases. 0. Today my hospital is full. It's full. We're building tents. We're building extra units. Not only my hospital, every hospital is packed with nebuch from people with COVID-19. Either they're in an ICU or on a respirator, Rahman al-Islam, or nebuch. They're being buried. If people don't understand the seriousness of this, they say, I feel fine. This is nonsense. So these people are what we call a chassid shota. They're fools. The Gemara is describing somebody sees a woman drowning. I can't go in because you can't touch a woman. You're called the chassid shota. Anybody that doesn't take this seriously is a chassid shota, and I would accent on the shota part because it's going to kill somebody. You're a rodef. The great poskim that say the person who doesn't take this seriously is a rodef. This is of paramount importance. This is pikuach nefashos. I don't think people realize the seriousness of this. If people go on Pesach to their Bubby and Zaidi, out to Bubbies and Zaidis, and somebody is a cough, they could, Rahman al-Islam, kill their elder Bubby and Zaidi. The mortality in 80-year-olds, especially if they're sick, could be 15 or 20%. That means in a room of 100 Bubbies and Zaidis, Rahman al-Islam, 20 of them could die because you wanted to have your kids say Manishtana in front of them.
I think over here in Brooklyn,
crazy.
Yeah, Doctor, I just want to mention to you that, because you mentioned about Brooklyn, I think here in Brooklyn people really are starting to take it very seriously. I think the shuls that you're mentioning are very, very, very minor. Most people are really keeping it. I think most people are not going there.
But those minor shuls need to close up. That's what the doctor's saying. Those minor shuls need to close up.
This isn't Rabbi Glatt who's a nothing. This is the Moetzes HaGedolah. That you must shut your shuls.
How does one...
How can anybody possibly against the Moetzes HaGedolah?
Dr. Glatt, how does one get infected by standing next to another person? So I want to explain to the listeners how easy it is for someone to for this COVID-19 to get transmitted to the next person.
Yes. And can you describe what does next to mean? Like when they say that thing about being 6 feet apart. Is 6 feet okay?
No. So let me explain carefully. This is very important. There are two critical ways, two major ways that COVID can be spread. Both are related to each other. When a person has the virus in their body, they're giving off that virus in the air around them when they breathe out, certainly if they cough or they sneeze. But even just by normal breathing, the virus can come out of your mouth. It goes into what we call droplets. And those droplets, they don't stay in the air for very long, and they don't travel very far. And that's why in the area around the person, 6 feet in all directions, maybe a little bit more. If you have a significant sneeze, it could go even further. But certainly in the area of 6 to 8 feet around the person, you're at the center of a circle of 6 to 8 feet all around you. There is potentially viral particles there. We don't know how long they last in the air. There are a lot of different factors that go involved in that. And if they land on something, or I coughed and I touched a doorknob, I coughed and I touched something, and then you touch that thing and you touch your mouth or your eyes, that's how easy it is to spread, either by people breathing it in or by touching something that has virus on it, and the virus can stay for quite a while, hours, maybe even longer than that, on certain surfaces, maybe even days. And if it's not cleaned, you touch your eyes, your mouth, your nose, you can get the virus. And that's why it is critical that people socially distance. If you're on the line in the store, you have to buy food. If you can't get it delivered, which is the better eitzah, and certainly older people shouldn't be going into stores. They should be setting up chesed teams to deliver it to the older people because they're at most risk. So when you're standing on the line, and it's a long line, Baruch Hashem, people can hard for large families to buy a Pesach order, you could be on line for 20 minutes. And you're sitting there coughing on the back of the person in front of you and the person in front of them, the person behind you. The entire line could be infected in 20 minutes.
Thank you, Dr. Glatt. We have Dr. Cofsky on the air with us. And my question is for both of you. You mentioned that people should get the food delivered to them. I went to a supermarket, and I haven't been out literally for 2 weeks. I sent my staff home. Everyone's working from home. And I had to get a few essentials. And when I came back with my packages, I left it in the car because I've been told that the germs could stay on the surface. So when people get packages delivered from Amazon, from UPS, or even just go shopping for essentials, how does one deal with it?
So I'll answer that, and I'll turn it over to my colleague, Dr. Cofsky, who's also a mumch in the field. And I do have to get off, so I apologize. So I'll just answer that first, and then I'll turn it over to Dr. Cofsky. So the CDC says that that's not a major route of transmission. It's not in food. It's not in water. It's not in the mikvahs. Men's mikvahs are a disaster because of the mingling. A woman's mikvah, if it's taken care of properly, is absolutely still allowed and should be encouraged, and women shouldn't be afraid. A men's mikvah is a disaster with all the mingling. Food, water, packages are not major routes of transmission. If you want to be smart, so when you open up the package, you throw away the package, you take out the contents, and you wash your hands afterwards. That's a smart thing to do. It's not going to be a major route of transmission, but it's a smart thing to do anyway because where are your hands coming into contact? We don't know what schmutz was on that package, so it's a smart thing to do whether it's COVID or not. But a person shouldn't go crazy with that type of concern, because those aren't major routes of transmission. You don't have to worry about the shmura matzah. Is that a problem with the hand shmura matzah? I don't think so. Is it a problem with packaged food that you're getting from the store? I don't think so. Is it a problem with prepared food that you're getting from the store? I don't think so. It never hurts to wash your hands before and after you're doing all the food preparations. That's always appropriate. And certainly one has to be very careful with the bathroom to wash one's hands well. For 20 seconds, washing with soap and water. On Shabbos, you have to wash this way as well. You're using cold water. It's not a problem. There are many different posts can tell you about whether you have to dilute the liquid soap or not dilute it. Follow your posek and wash your hands with whatever your posek says is the proper way to wash your hands on Shabbos and Yom Tov. It's a chiyuv. Chazal said up until Yadayim, not for the purposes of getting rid of COVID-19, but HaKadosh Baruch Hu knows that washing your hands before you eat is a very smart thing to do. And maybe that's part of the reason. We do it because Chazal tell us to, but it happens to be a very smart thing medically. So you can never wash your hands too much appropriately, but that's not the way COVID is spread through Amazon packages. COVID is spread through personal contact and coming to contact with the area where a person just coughed, sneezed, breathed, and it hasn't been cleaned, and then you touch your nose, your mouth, your eyes. That's how it's spread. I thank you very, very much.
Thank you very much. So Dr. Glatt, before we get to Dr. Cofsky, I just want to ask you, give one last message to those shuls that are still open, those people who are still outside socializing and talking and mingling. And, I tell people that that's what a phone is for. If you go into a supermarket, don't mingle with each other. Just talk to them on the phone. Give one final message to all our listeners that, the fact that some shuls are still open and the fact that people are still socializing.
So I thank you for that, giving me this last chance to stress this. So I'll tell you two things. Go to a hospital. Visit a hospital and see the disaster that's going on. People who don't have COVID are going to come into the hospital. They're not going to be able to get taken care of. People are going to, Rahman Islam, die of diseases that we could handle if we weren't overwhelmed with the tragedies of COVID right now. So that's the first point. Go visit a hospital. Ask any doctor who works in a hospital whether this is made up. Is this fake news? The second thing I would tell everybody, any shul that's open, any yeshiva that's open, I would demand that you not support that yeshiva, not support that shul. When this B'ezras Hashem is going to be over, HaKadosh Baruch Hu Hashem Yirachim, this will be over. I would beg you, nobody should support a single meiser that went against the Moetzes Hagedolah. If we don't take the words of our Gedolim to heart, if we allow people to make chayzik of the Gedolei Yisrael's psak halacha, those don't deserve our support. They should be shut down financially. Nobody should daven in a shul ever again that is open right now. It's a shanda that shuls open. Any rabbi who goes against the Moetzes Hagedolah, he paskins, he knows better than the Gedolei Yisrael. He knows better than the mumcha doctors. If I tell you to be Michal Shabbos and Yom Kippur on Shabbos, you have to listen to me. If I say it's Pikuach Nefashos, you have to listen to me. So if you have all the mumcha doctors, if you have all the Gedolei Yisrael, any shul that opens right now, Lanias Dati, that's not a shul. That's a base tiflus. And it should be closed down financially, and nobody should go there.
Thank you, Rabbi Dr. Aaron Glatt. Thank you so much.
I'm sorry for being so vehement about this.
Well, that's people need to hear
I beg
that.
people to visit my hospital, visit my emergency room, and see the disaster that their callousness and their lack of taking this seriously, Rahman al-Litzlan, is causing to Klal Yisrael. I beg you, please listen to what I'm saying. Listen to what Dr. Cofsky is saying. It's not too late, but for many people it is, unfortunate. Thank you so much for having me. You should be, as Hashem, be continue to do wonderful work for Klal Yisrael as a councilman, and you should have a Chag Kosher V'Sameach.
Thank you, and the same to you, Rabbi Dr. Aaron Glatt. Thank you so much.
Thank you.
So we're here with Dr. Richard Cofsky, who's an infectious disease specialist in Brooklyn and is affiliated with multiple hospitals in the area, including Mount Sinai Beth Israel Hospital and Brookdale Hospital Medical Center. And I have to tell you, Doctor, I have been on the phone with you this week. How many times? I mean, literally every single day.
Several times each day.
Several times each day, and I want to thank you because you have been so accessible, and you could be in the hospital and you pick up the phone, you know it's always something crucial, something important, a community issue, and you always answer your phone. So I want to thank you for being so accessible, and also the conference calls, the late night. I think we had a conference call just the other night until I think we ended at 1:30 in the morning, discussing community issues. So what message do you have for our listeners, regards to social distancing and how crucial and what you see in the hospital?
So we'll talk about the hospitals first. One of the hospitals in Brooklyn has an emergency room that is designed for 14 to 15 patients, and there's surges when they have 25 or 30. At that time, they have some stretchers in the hallways instead of the cubicles. Yesterday and the day before, that hospital had approximately 85 or 90 patients in that area. Stretchers next to each other, very sick patients. A few of them were on respirators. Most of them were having trouble breathing. They had a mask on, and they were not that distant from other patients. Some of them died either in the emergency room or shortly after they went upstairs. Other hospitals, very similar pictures. Emergency rooms are very crowded. Patients on respirators in emergency rooms cannot get up to an ICU because the ICUs are filled. A nurse I spoke to this evening described one of the hospitals as a war zone. Multiple patients being put on respirators, some of them dying very rapidly, constant codes, otherwise known as cardiac arrests. Unfortunately, since there's no visiting in this epidemic, people are dying without relatives there. It's beyond what I think any physician has seen in this country in any epidemic, except possibly the 1918 Spanish flu, and that's 100 years ago, so none of us remember that. The virus is probably as contagious as Ebola, or close to it, but is not as lethal. However, the rapid spread and the spread to those who are particularly vulnerable have left the hospitals dealing with many times the number of patients they're designed to treat, even in a surge time. This is beyond any surge.
So, Doctor, I think it's important that for our listeners to hear from someone who actually has coronavirus and who's been laying in bed. So I'm going to put on our next guest is my colleague, New York City Councilman Mark Levine, who serves as the chairman of this New York City Council's Health Committee, and he heads that committee, the Health Committee. Councilman Levine has been one of the loudest voices in the media urging New Yorkers to abide by the guidelines recommended by the doctors and Department of Health. And such of the things that we have heard today from you and from Rabbi Dr. Glatt. Earlier this week, Councilman Mark Levine announced on social media that he likely had coronavirus himself, and he's currently home and he's self-isolating. Mark, welcome on the air. And my first question to you, how do you feel?
Well, thank you, Chaim. It's great to be back on, and thank God I am improving. I feel much better today than 2 or 3 days ago. I am not through this yet. I'm told to expect it'll take about 7 or 8 days, but I feel lucky that I've had a comparatively light case of this relative to those who are really struggling in hospital. And that's a really important point, that 80% of people who contract the disease will actually not require hospitalization. They will be able to rest and heal at home, and they'll experience something between a cold and walking pneumonia. I'd say in my case it was kind of like a bad flu with fever and dry cough. Those are very typical symptoms. And, many of your listeners may soon confront those symptoms themselves, and they're probably asking what they should do. And there's some important pieces of advice that I can offer are from my own experience and that of public health experts, which is that most folks actually don't need medical attention unless their symptoms persist for more than 3 or 4 days, or they should take a more difficult turn, such as having difficult breathing. Otherwise, rest, hydration, taking over-the-counter medication for the fever, that generally is enough, and you will recover, and people should take some hope in that. But it's not just about taking hope, it's about protecting the hospital system and preserving the resources there for those who are most critically ill. Rabbi Dr. Glatt spoke about the enormous pressure in our hospitals right now and our need to preserve that capacity for people who are truly facing life-threatening circumstances. And so that means for the rest of us, if our symptoms are relatively mild, meaning fever and cough, we really should just rest at home, heal, isolate from our family, and in most cases, we will get better, as, thank God, I am doing now.
Thank God. I'm glad I called you earlier tonight, and you sounded a lot better than when I first heard you on the conference call with our colleagues in the New York City Council. Yes. People call me every single day, and this is to Dr. Cofsky as well. People call me every day. Oh, where can I take a test? So if someone has some mild symptoms, Dr. Cofsky, what should they do? Like Councilman Mark Levine mentioned that they should not take the test, and you did mention how full the hospitals are. So what should they do if they start feeling sick, and when should they seek medical attention, doctor?
We still do not have enough testing capacity. And those tests, other than hospitals, take very often 4 or 5 days to come back. The hospitals now have tests that are coming back in a day or so. One should not go to the emergency room for mild symptoms. The symptoms of COVID are fever, cough, and trouble breathing. If somebody has significant trouble breathing, then they have to be evaluated because of the trouble breathing. But fever and a cough, under most circumstances, even when there's a suspicion or a strong suspicion of COVID, stay home. Fluids, take Tylenol. Probably don't take Motrin or Aleve. And most of these do get better. If there's trouble breathing, then they require further evaluation by a physician or an emergency room.
So if you have family members at home, like Mark Levine has, so you have to isolate yourself from others, otherwise they would catch it, right?
Yes.
So Mark, how have you been coping?
That's been the most difficult part, Chaim. I've tried to stay closed in my own room and tried to avoid close contact. It's hard when you have kids at home, but it really is a matter of safety for them. Look, it's not too different from if you had a family member who had a bad case of the flu, and you just want to make sure that if there's kids around, perhaps they weren't in too close contact with a parent who was sick that way. It's very difficult in close quarters, but it means you've got to do the hand washing and the hand sanitizing when you're at home the way that we otherwise might do when we go out in public. I want to echo what Dr. Cofsky said. He was extremely eloquent in stating what's at stake for people who have minor symptoms versus those who need to go to the hospital. But I do want to make one more point on testing, which is that if you have a minor case of coronavirus, such as myself, that a test result actually doesn't give you any useful information because the advice is going to be the same. Just rest. This isn't like the flu where there's a prescription like Tamiflu you can be given once you know the diagnosis. Sure, when people are hospitalized and are facing dire consequences, getting a test result for coronavirus actually can help direct treatment. But for most of the rest of us, it doesn't tell your doctor anything new that they wouldn't already have advised you. And so to think that someone who is otherwise ill is getting out of their bed, leaving their home, going to some public location and to pursue a test where they might contaminate others, or if they're in fact actually still negative, they might contract the virus themselves. Well, that's just not in the interest of anybody. And furthermore, look at the staff who's manning the testing facilities, and look at the protective gear they're wearing. That's protective gear which could have been used in the hospital, and in fact the staff itself could have been in the hospital. That's why now the City Health Department has really strongly advised that testing would be reserved for those who are sick enough to be hospitalized or those who have health complications. That there are cases where someone has a significant pre-existing condition and their doctor will determine that they want to test. But those are really special cases that thankfully don't apply to most of us. I know this is probably not the messaging that your listeners were getting as recently as even a week or two ago. That's why I'm spending a little bit of time on it. But this really is now the message being delivered by our public health authorities in the New York City Health Department.
Thank you. And Dr. Cofsky, if someone has the flu, does that mean that individual does not have COVID-19?
It's not clear. A week or two ago, we were saying that most people who have flu don't have COVID-19, but we have seen some people who have both. I think this is becoming less of a relevant question because flu is decreasing, but there is that possibility. And an emergency room that tests for flu, even if it's positive, should generally test for COVID-19. Again, we're dealing with patients who are sick enough to come to the emergency room. So
it really doesn't make a difference if someone gets tested or not. If someone's not feeling well, in other words, they should just self-isolate themselves. Yes. And like you mentioned before, stay in a room for 3 days. And if you get better, how much longer should they stay in?
Somebody who's recovering should stay in for at least 3 days after the fever has disappeared and after the symptoms have resolved. And even if they have to go outside after that period, probably should decrease their contact as much as possible, maybe wear a mask, but at least a minimum of 3 days after symptoms resolve, and that's for essential people. Other people, I would say, should probably go 7 days.
Okay, great. So that's good information, and also that if you isolate yourself for 3 days and then you start getting high fever and the shortness of breath and your cough gets worse, then you definitely have to seek medical attention. So first of all, I want to thank my colleague, Councilman Mark Levine, chaired the New York City Health Committee and the New York City Council, who is isolating and quarantining himself at home with his family, and he's staying in a separate room. So I want to thank you, Mark, for being on, and I wish you a refuah shalema. You should get better quickly, and I look forward to seeing you back in the council once this is all over. So thank you, Mark. We're going to continue.
Thank you, Chaim.
Thank you.
Pleasure to be on.
Thank you.
Be safe, everybody.
We're going to continue with Dr. Richard Cofsky, but our call-in number is 718-303-9090. We'll see if we can take a few calls, 718-303-9090. And we're going to take a commercial break, and we'll be right back.
TCN, Talkline Communications Network Radio, America's #1 Jewish program.
And welcome back. You're listening to Talkline Communications Network, Chaim on the radio. This is New York City Councilman Chaim Deitch, and we are listening here live on the radio to Dr. Richard Cofsky, who is an infectious disease specialist in Brooklyn and is affiliated with multiple hospitals in the area, including Mount Sinai Beth Israel Hospital and Brookdale Hospital Medical Center. So we're going to take a call, and let's take a call. Rifki from Borough Park. Go ahead. Question for Dr. Cofsky.
First of all, it's a fabulous program. Dr. Cofsky, I would like to know, we're getting messages about not using ibuprofen or aspirin. That's got us a little stumped, only to take Tylenol because they found that the other things were making the virus worse. I was wondering about heart patients that take baby aspirin. And I was also wondering, I get sinuses at pace of time from the stress and the change of weather, and I'm supposed to use these nose drops that have a drop of cortisone in it. Is that a problem?
Baby aspirin is not a problem. It's a very low dose. The nose drops with a drop of cortisone is also an extremely low dose. Neither of these is going to interfere. By the way, these recommendations not to use Motrin are for people who have the disease. We're not talking about healthy people who were exposed to somebody. These are for people who really are seriously ill with corona. So most people, the way you're phrasing the question, the healthy people who are using these for cardioprotective use of aspirin or for mild sinusitis, even if that it's not an issue.
It's not an issue. We're just all so afraid that we might have it or not realize it, that we don't want to take a chance, and that's why we're...
These only are issues for people who definitely have it, who have significant cases.
Thank you, Ricky.
And to add something to that, I think there was a concern about transmitting for packages.
Yeah.
Rabbi Glatt addressed that. I will add another level here. Even if there's a concern that somebody touched something that might possibly have COVID on it, the simplest thing to do, and it's effective, is to wash his or her hands with soap and water. And that would eliminate just about all the possibility from touching something.
Great. Thank you, Rifki. Doctor, I have a question. When someone is not feeling well and they isolate themselves in a room, so what is the difference? Who has to wait 3 days and who has to wait 7 days? How does it work?
I think most people who've had definite cases or very highly suspicious cases of COVID should wait 7 days before they go outside. 7 days from the resolution of fever and symptoms. There are certain essential people who, on an individual basis, may be able to do it after 3 days. But that should be discussed with a physician or the health department.
Thank you very much. That's very informative. Thank you, Dr. Cofsky. And we're going to put our next guest on the air, and our final guest tonight. And Dr. Cofsky is going to stick around a little bit in case we get any more phone calls. The phones are ringing, but we don't know if we're going to have enough time to answer those calls. But we're joined on the air with Rabbi Boruch Bender, the founder and president of Achieza Community Resource Center in the Five Towns in Far Rockaway. 2 weeks ago, when New York City was just starting to understand how serious COVID-19 was, the Five Towns Far Rockaway From community was already shutting down shuls, closing schools, and making a strong effort to completely eliminate social interactions. And they have been actually ahead of the rest of the city by 3 weeks, 2-3 weeks. So, Rabbi Boruch Bender, welcome live on the air. And Rabbi Bender, you were at the forefront of the effort to prepare your community for the incoming health crisis. What gave you and the local Rabbanim that foresight?
Well, first of all, thank you very much for having me. And thank you, Faye, and thank everybody involved in this. I think this is tremendous. The more we can discuss what's going on. Yes.
I just want to say I'm so happy that you came on because you are just a wealth of information. So thank you so much for coming on.
I appreciate that, and thank you for having me. And I guess, first and foremost is we learned everything that is truly siyata d'shmaya. But, what happened was, as is developed, we we're a community, and that doesn't make a difference whether you live in Far Rockaway or Brooklyn or Lakewood or anywhere else. But our community, we like to be in control. I think that's what it comes down to. And we are confident people, and we take care of ourselves. And when we hear things that sound crazy and sound outrageous and and just hard to put your finger on it, it's hard to act upon it, despite the warnings that are around you. And a couple of weeks ago, you hit the nail on the head. Very good friends of both of ours, mutual friends who we both love and respect. They called me and they thought I was crazy. And they were kibitzing and making fun of me. You're allowing the community shutting down and shuls and yeshivas. And simply put, if we were listening to the doctors that always guided us, doctors from Long Island like Rabbi Dr. Glatt, doctors from across Brooklyn, like Dr. Cofsky was just talking, doctors in the city. They said the facts speak for themselves, and this is coming. And the only way, we're not going to stop it. We can't run from it. We can't pay our way out of it. We can't hide from it. Well, the only way out, actually maybe is hide from it, is to curb our enthusiasm to be everywhere and do everything and shut it down. And once we saw that evidence, I wouldn't say evidence, but once we saw so many of the physicians that we speak with, because we're so involved in healthcare throughout the year, we simply decided to listen to them because we always do. And there's no reason now to be skeptical. And I give a tremendous amount of credit to the Rabbanim of the Far Rockaway 5 towns area. They got on the phone call with a bunch of us Friday afternoon at 3, 4 o'clock, a couple hours before Shabbos. It's now going to be, 2 full weeks tomorrow. And we called a couple doctors on the line, and once they heard it, and it was clear, forget all the evidence, but if we're going to save one life because of this crazy measures of shutting down, then we've got to do it. And I can't say that we're perfect or even great, because we're not. The neighborhood is suffering with a tremendous amount of illness and positive cases. But I am grateful because I know from so many physicians that they feel we could have been so much worse had we not shut the neighborhood the way we did.
Thank you, Rabbi Benda. We're going to take a call. We just got disconnected. So let me ask you, Achieza was said to be leading testing efforts in the 5 towns for Rockaway community. Can you speak a little more about that?
Absolutely. Over the first several days, it was very clear that even though we had extremely close communications with the health department, both in Nassau County and New York City, and Dr. Zucker himself was on the phone with myself and my staff numerous times, which is impressive for him. He's running the healthcare in the whole state. But it was clear when there was so much unknown that there were people that needed to be tested. I know there's misconception about everybody getting tested, but the same physicians who guided us told us it would be a good idea to bring testing to the neighborhood because there just wasn't enough to go around, and there were people who were suffering. At that point, it was like, oh my God, there's somebody positive on your block. It was like this crazy thing, Now it's like,
how many cases? How many cases do you find to be then?
What, 2 weeks ago?
Yeah, when you first started testing.
When we had that phone call, okay, which is right before we tested, we knew of, and Achiezer, dealing with a lot of healthcare, is a desk that gets called with many of this. We were aware of approximately 10 cases of people that were possibly infected. That's it. A community of thousands and thousands of people. But we knew there were 10. They were all very active members of the community who were symptomatic, but it was Yechidim. It was very few. But by the time the weekend ended, it was 30, it was 40 that were symptomatic. So we figured we were almost looking at a New Rochelle situation. And Dr. Glatt and others told us, if you can bring testing, get it here. And we were able to test several hundred people. The health department got in touch with us because they wanted to make sure we did it right. And it was very clear after the first round of testing that many people were coming back positive. So we then knew that for Rockaway 5 towns, had this outbreak, and whatever oomph, if you will, or chizuk the Rabbanim needed to close and to make sure we stayed closed, and others that hadn't closed yet, they had it very quickly because of that testing. So I like to think that you never know about the life you don't save, or the life that you save that you don't know about, but certainly the fact that we got people tested and people said, oh boy, it's not 10 people, it's not 20, it's not 30, it definitely, I wouldn't say panic, but it scared people in a healthy way. The people said, okay, we really got to stay home.
And something, thank you for your efforts, and thank you for being in the forefront. So we only have a few minutes left to the program, so sure. I want to ask Dr. Cofsky, give our listeners a final message about social distancing and how crucial this is and how widespread this virus is. People are dying every day.
The mortality rate is going up very fast. The emergency rooms cannot handle it. The hospitals cannot handle it. We don't know, people don't realize how contagious it is, how easy it is to spread. It's a chiyuv on everybody to do their utmost to prevent the spread. That means, unless it's in your house, you have to do everything possible to reduce social social contact. Stay at least 6 or 8 feet away from somebody if you have to go out. Minimize your contact in stores. Don't gather when unless it's absolutely necessary, and even when you do so, stay several feet away from the other person for as short a period as possible.
And that's so important. So, Dr. Richard Cofsky, I want to just thank you once again and for being in the forefront. And again, I'm sure we're going to be speaking a couple of times every day with the Rabbanim in the neighborhood and the community leaders. And you've been really, amazing in giving us the guidance that we need. So I want to thank you once again, and I want to thank Rabbi Baruch Benda and my colleague, Councilman Mark Levine, as well as Rabbi Dr. Glatt for joining us in the program. And we're going to continue next week with Department of Labor and speaking about the unemployment rate and other resources, City Council resources next week. So until then, remain safe, stay home, and practice social distancing because this is crucial. Lives matter. So until next week, I want to wish everyone a Shabbat Shalom.